Hello guys, and welcome back to our show, Science Now. And today we're going to be going in depth about the field of anesthesiology. And we have the guest, Dr. Frederick Javier. Hello.
Yeah, pleased to meet you.
How are you doing today?
Fine, busy though.
Alright, let's get straight into it.
Alright.
So my first question is, what is an anesthesiologist?
So basically, an anesthesiologist is a doctor who specializes in anesthesia, and that is the practice of using medicine for a patient to achieve unconsciousness.
And I also want to ask, what are the responsibilities of an anesthesiologist?
Administering the correct anesthetics to the patients in the right dosages. Also, monitoring the patients and my team, who I work with, like the surgeons, nurses. But what's most important is the safety and well-being of our patients.
Oh, wow, okay. What did it take for you to get here?
It took me 12 years. Yeah.
That's a lot if you ask me.
Yeah, so I had to earn my 4-year bachelor's degree in Stanford, and then later on another 4 years in graduate education to get my MD, followed by another 4 years in an anesthesiology residency program.
That sounds boring. When you did that for 12 years.
Yeah, well, it pays off.
I know everybody wants to know, how much do you make for your salary?
Well, there's a vast range for anesthesiologists, especially considering where you live, where you work. For around here, it's about $300,000 to $400,000 a year. For me, it's $360,000 for yearly salary, but you can expect more later on the years.
Can you give me your typical day and how would it be like in the hospital?
Well, there is no typical day for me. The hours are very unreliable, no schedule. I go wherever I need it, and you had to expect unexpected. A lot of things can happen, and operations I work with are very diverse. But usually the hours every week would be between 40 to 50 a week, yeah. And I work in ICUs, which are intensive care units, for the patients who are in dire need or in very intense situations that need helping out immediately. And usually it's not just one operation at a time, it's actually 2 to 3 for me, working with different sets of patients, different teams in such a small amount of time. So it can be quite stressful.
How do you cope with all that?
Well, you just know you gotta keep calm and keep in the mindset, in your head that everything is fine because, you trained for this 12 years, and it'll just slip right through if you know what you're doing, which you should know what you're doing.
Yeah.
And I always do.
Agree. Was there like a really intense situation in the ICU?
As a matter of fact, yeah, in the ICU a few months ago, something happened. So this old man was just carried in a stretcher straight inside the door of the hospital, and someone told me it was a heart transplant he needed really badly. And so out of no notice, they just picked me as the anesthesiologist to operate on him. And so we had everything except for enough information needed to administer the right dosage of anesthetics. And so I had to look back at all the factors of vitals, like the blood pressure and even the allergies.
Yeah.
And finally I did, and gave him propofol, the most common, which I thought was safest. But I was still anxious to give it to him, but it happened anyways. And the surgery was being done. I was helping the surgeon out with everything, and then it got done smoothly after that. But I was scared the whole time. But
I heard you mention propofol. Can you further explain what that is?
Well, propofol, yeah, like I said before, the most commonly used in the U.S. for general anesthesia. What it really does is numb your nerves and makes you sleep. You could also call it diisopropylphenol. A common marketing name is diprivan, and it is injected through a vein directly and can last 5 to 10 minutes. And some background information. It was first discovered in 1977 and approved in the U.S. in 1989.
Is there any risks of propofol?
Oh, propofol. No, not any risks you should really worry about. Not the patient. Like I said, again, very low. Our training is what really affects the probability of risks or not. And its addiction rate, very low actually. Moderate to low actually. But what you can get is propofol infusion syndrome, PRIS. That's when you take too much for long, extensive periods of time, and it could later cause cardiac failure, kidney failure, maybe even death, depending on how severe.
And lastly, do you have any tips for high school students who are trying to be an anesthesiologist?
Yeah, just in general in the field of medicine, you'll
There's a bug in here. Nasty.
so you'll need many years of science. AP would be good for ones in high school. So for you kids out there, keep your grades up for science. Make sure you pass the classes, and you can even volunteer in the hospitals, get hands-on with nurses, doctors.
Alright, guys, and that wraps it up for our interview with an anesthesiologist. That's the 20th time of me trying to say that. Okay. Thank you guys for watching. Hope you all enjoyed. Make sure to donate in that link below, because that is really important and we need the money. Yeah, see you guys next time when we have enough money.
So there was a bike rider. Oh no, wrong story.
What was that? So, are you tips for like? What are you doing? I don't drink decaf.
What? Okay, let's just cut this whole thing. It's been 4 minutes.